CEN Written Exam Sample Questions. Question 1. A patient presents with sudden onset of right-sided weakness, facial droop, and aphasia. The last known well time was 3 hours ago. What is the priority action? Option A. Obtain a stat CT head, non-contrast. Option B. Administer aspirin 324 mg. Option C. Start 4-alteplase, TPA. Option D. Obtain an MRI. The correct answer is option A. Obtain a stat CT head, non-contrast. This patient is having an acute ischemic stroke. The priority is a stat non-contrast CT head to rule out hemorrhage before administering TPA. The time window for 4 TPA is within 4.5 hours of last known well. This patient is within the window. However, CT must be done first to rule out hemorrhagic stroke, which is a contraindication to TPA. Aspirin may be given after TPA is ruled out. Question 2. A patient with a suspected fracture has a pulse that is absent. The CEN should: Option A. Apply a splint and reassess. Option B. Apply a tourniquet. Option C. Reduce the fracture. Option D. Call for an orthopedic consult. The correct answer is option A. Apply a splint and reassess. If a fracture is suspected and the pulse is absent, the CEN should apply a splint to align the bone and reassess the pulse. If the pulse returns, the circulation is likely adequate. If the pulse remains absent, it may indicate arterial injury, requiring an orthopedic and vascular consult. Tourniquets are for bleeding control, not for absent pulses. Reduction is done by a physician, not by the CEN. Question 3. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50 mmHg? Option A. Atrial fibrillation with rapid ventricular response. Option B. Supraventricular tachycardia, SVT. Option C. Ventricular tachycardia with a pulse. Option D. Atrial flutter with 2:1 block. The correct answer is option C. Ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario. Question 4. A patient with suspected influenza should be placed on which type of precautions? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option B. Droplet precautions. Influenza is transmitted via respiratory droplets, coughing, sneezing, or talking. Patients with suspected influenza should be placed on droplet precautions, a surgical mask within 3 feet of the patient, and the patient should wear a mask when leaving the room. Airborne precautions are for TB and measles. Contact precautions are for C. diff and MRSA. Question 5. A patient with a stroke is being transferred to a comprehensive stroke center. Which law applies to the transfer? Option A. EMTALA. Option B. HIPAA. Option C. OSHA. Option D. ACA. The correct answer is option A. EMTALA. EMTALA governs the transfer of patients between hospitals, ensuring that patients are transferred only after they have been stabilized, or if the benefits of transfer outweigh the risks, and that the receiving facility has accepted the patient. The transfer must be done with appropriate documentation and personnel. EMTALA applies to emergency care. Question 6. A patient is suspected of being a victim of human trafficking. The CEN should: Option A. Notify security and social work. Option B. Notify law enforcement. Option C. Provide a private space for assessment. Option D. All of the above. The correct answer is option D. All of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential. Question 7. A patient with a tracheostomy tube dislodges it. The CEN should: Option A, call respiratory therapy. Option B, reinsert the tracheostomy tube immediately. Option C, cover the stoma and ventilate via bag mask over the mouth and nose. Option D, suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities. Question 8. A patient with stable supraventricular tachycardia, SVT, is not responding to vagal maneuvers. Which medication should the CEN anticipate? Option A, amiodarone 150 mg 4. Option B, adenosine 6 mg rapid 4 push. Option C, diltiazem 20 mg 4. Option D, metoprolol 5 mg 4. The correct answer is option B. Adenosine 6 mg rapid 4 push. Adenosine is the first-line medication for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. The initial dose is 6 mg. If ineffective, a second dose of 12 mg may be given. Adenosine works by transiently blocking AV node conduction. Amiodarone, diltiazem, and metoprolol are also used for rate control in certain tachyarrhythmias but are not first line for SVT. Question 9. A patient with a suspected stroke has a blood pressure of 190/105 mmHg. The CEN should: Option A, administer 4-labetalol to lower blood pressure. Option B, permit hypertension unless the patient is receiving TPA. Option C, administer sublingual nifedipine. Option D, start a nitroprusside drip. The correct answer is option B. Permit hypertension unless the patient is receiving TPA. In acute ischemic stroke, hypertension is often permissive to maintain cerebral perfusion pressure, CPP, in the ischemic penumbra. Routine blood pressure lowering is not recommended unless the patient is a candidate for TPA, in which case BP should be lowered to 185/110 mmHg before TPA administration. After TPA, BP should be maintained 180/105 mmHg. Question 10. A patient with suspected C. difficile infection should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option A. Contact precautions. C. difficile is transmitted via the fecal-oral route, contact with contaminated surfaces or feces. Patients should be placed on contact precautions, gloves and gowns, with hand hygiene using soap and water. Alcohol-based hand rub is not effective against C. diff spores. Private room is preferred. Droplet and airborne precautions are for respiratory infections. Question 11. A patient who is a minor, under 18, is brought to the ED with a life-threatening condition. The parents cannot be reached. The CEN should: Option A, wait until the parents are reached. Option B, provide life-saving treatment under implied consent. Option C, call Child Protective Services. Option D, transfer the patient to another hospital. The correct answer is option B. Provide life-saving treatment under implied consent. In emergencies, implied consent allows healthcare providers to treat a minor without parental consent when the patient's life or limb is in danger and a delay could cause harm. The CEN should also notify the parents and CPS as required. This is part of the EMTALA requirements. Question 12. Which medication is used to manage postpartum hemorrhage? Option A oxytocin. Option B misoprostol. Option C tranexamic acid. Option D. All of the above. The correct answer is option D. All of the above. Postpartum hemorrhage, PPH, is managed with uterotonics. Oxytocin is the first-line agent, misoprostol and methylergonavine are second-line or adjunctive agents. Tranexamic acid is a recent addition to the management of PPH, reducing bleeding and mortality. Uterine massage, fluids, and blood products are also indicated. Question 13. A patient with a long bone fracture presents with severe pain out of proportion to the injury, swelling, and pallor. The patient has a cast. Which diagnosis should the CEN suspect? Option A compartment syndrome. Option B fat embolism. Option C osteomyelitis. Option D DVT. The correct answer is option A. Compartment syndrome. Compartment syndrome is a surgical emergency characterized by pain out of proportion to the injury, pallor, pulselessness, paresthesia, and paralysis. The 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. It occurs when pressure within the compartment exceeds perfusion pressure, leading to ischemia and necrosis. Immediate fasciotomy is required to prevent irreversible damage. Question 14. A patient with acute aortic dissection presents with a tearing chest pain radiating to the back. Which finding is most suggestive of this diagnosis? Option A widened mediastinum on chest X-ray. Option B blood pressure 180/110 mmHg. Option C pulse deficit between arms. Option D. All of the above. The correct answer is option D. All of the above. Aortic dissection presents with tearing chest pain radiating to the back. Classic findings include a widened mediastinum on CXR, hypertension or hypotension if tamponade/rupture, and a pulse differential between arms, or blood pressure differential 20 mmHg. Key management includes blood pressure control, target systolic 100 to 120 mmHg, with beta blockers and emergent surgical consultation. Question 15. A patient with anaphylaxis presents with stridor, hypotension, and respiratory distress. The CEN should: Option A administer epinephrine IM. Option B administer epinephrine 4. Option C administer albuterol nebulizer. Option D administer diphenhydramine 4. The correct answer is option B. Administer epinephrine 4. IM epinephrine is first line for anaphylaxis, but in severe cases with hypotension and stridor, airway compromise, 4-epinephrine may be needed. 4-epinephrine is a more potent vasoconstrictor and inotrope, reserved for severe presentations. Albuterol and diphenhydramine are adjuncts, not primary. Question 16. Which of the following is an ethical principle in emergency nursing? Option A beneficence, doing good. Option B non-maleficence, doing no harm. Option C autonomy, patient's right to decide. Option D. All of the above. The correct answer is option D. All of the above. The core ethical principles in emergency nursing include beneficence, doing good for the patient, non-maleficence, avoiding harm, autonomy, respecting the patient's choices, and justice, fair treatment. These principles guide nursing practice and decision-making. The CEN should respect these principles in all patient interactions. Question 17. A patient presents with a chemical splash to the eye. The CEN should: Option A neutralize the chemical with a buffer. Option B irrigate the eye continuously until pH is neutral. Option C. Patch the eye and refer to ophthalmology. Option D. Administer antibiotics. The correct answer is option B. Irrigate the eye continuously until pH is neutral. Chemical eye injuries require immediate and continuous irrigation with normal saline or lactated Ringer's solution until the pH of the eye is neutral, pH 7.0. Alkali burns are more damaging than acid burns and require extended irrigation. Irrigation should begin immediately and continue for at least 15 to 30 minutes. For severe alkali burns, it may take hours. Antibiotics and patching may be used after irrigation. Question 18. Which of the following is a clinical feature of a pulmonary contusion? Option A. Hemoptysis. Option B. Chest wall crepitus. Option C. Subcutaneous emphysema. Option D. Unilateral wheezing. The correct answer is option A. Hemoptysis. Pulmonary contusion, bruising of lung tissue, often results from blunt chest trauma. Clinical features include hemoptysis, hypoxia, and opacities on chest X-ray that develop over 24 to 48 hours. Chest wall crepitus and subcutaneous emphysema suggest pneumothorax or rib fracture. Unilateral wheezing suggests a foreign body or bronchial obstruction. Treatment is supportive with oxygen and pain control. Question 19. A patient with a history of HIV/AIDS presents with a fever and dyspnea. The CEN should suspect. Option A. Pneumocystis jirovecii pneumonia, PCP. Option B. Tuberculosis. Option C. Bacterial pneumonia. Option D. All of the above. The correct answer is option D. All of the above. Patients with HIV/AIDS are immunocompromised and susceptible to a range of opportunistic infections. PCP, Pneumocystis jirovecii pneumonia, is a common cause of pneumonia in HIV patients. Tuberculosis and bacterial pneumonia are also possible. The CEN should implement appropriate isolation precautions, airborne for TB, droplet for others, while evaluating the cause. Question 20. A patient has a left-sided stroke. The CEN should anticipate. Option A. Right-sided weakness and expressive aphasia. Option B. Left-sided weakness and neglect. Option C. Right-sided weakness and impulsivity. Option D. Left-sided weakness and aphasia. The correct answer is option A. Right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 21. A patient presents with a fracture of the tibia and fibula after a motor vehicle accident. The patient has a palpable pedal pulse and sensation. What is the initial action? Option A. Reduce the fracture. Option B. Apply a splint to immobilize. Option C. Apply a tourniquet. Option D. Perform a neurovascular assessment. The correct answer is option D. Perform a neurovascular assessment. The first step in any fracture assessment is a neurovascular assessment: pulses, sensation, movement, color, temperature. Even if the pulses are palpable, the CEN should document the baseline to monitor for changes. Splinting is important to prevent further injury, but neurovascular assessment comes first. Tourniquet is for bleeding control, not for fractures. Question 22. A patient with a suspected stroke is being evaluated. The CEN should: Option A. Perform a focused assessment, FAST, face, arms, speech, time. Option B. Obtain a CT head. Option C. Check the blood glucose. Option D. All of the above. The correct answer is option D. All of the above. Stroke assessment includes a focused FAST, face, arms, speech, time, examination, CT head to rule out hemorrhage, and blood glucose check to rule out hypoglycemia, which can mimic stroke. This is part of the emergency stroke protocol. A CT head is essential before TPA administration. Question 23. A patient with alcohol withdrawal presents with tremors, hypertension, tachycardia, and diaphoresis. The CEN should anticipate. Option A: benzodiazepines, lorazepam, chlordiazepoxide. Option B: antipsychotics. Option C: beta blockers. Option D: 4 fluids only. The correct answer is option A. Benzodiazepines, lorazepam, chlordiazepoxide. Benzodiazepines are the first-line treatment for alcohol withdrawal, reducing the risk of seizures and delirium tremens, DTs. They work by augmenting GABA, thus preventing sympathetic overdrive. Chlordiazepoxide, Librium, and lorazepam, Ativan, are commonly used. DTs are a medical emergency requiring ICU-level care. Antipsychotics and beta blockers are adjuncts or alternatives but not first-line. Question 24. A patient with cardiac arrest has a rhythm of ventricular fibrillation, VF, on the monitor. The patient has received 2 defibrillation attempts and 1 dose of epinephrine. What is the next medication to administer? Option A: amiodarone 300 mg 4 push. Option B: lidocaine 100 mg 4 push. Option C: magnesium sulfate 2 g 4. Option D: sodium bicarbonate 50 ml equivalent 4. The correct answer is option A. Amiodarone 300 mg 4 push. For shock refractory VF/pulseless VT, the ACLS algorithm recommends amiodarone 300 mg 4/IO push after the second shock. A second dose of 150 mg may be given for recurrent VF/VT. Lidocaine is a second-line alternative. Magnesium is for torsades de pointes. Sodium bicarbonate is not routinely recommended except in specific scenarios, hyperkalemia, tricyclic overdose. Question 25. A patient with suspected carbon monoxide poisoning has a headache, nausea, and confusion. The CEN should. Option A: administer high-flow oxygen via a non-rebreather mask. Option B: obtain a CT head. Option C: administer activated charcoal. Option D: obtain a carboxyhemoglobin level. The correct answer is option D. Obtain a carboxyhemoglobin level. CO poisoning presents with headache, nausea, confusion, and cherry red skin, late sign. The diagnosis is confirmed with a carboxyhemoglobin, COHB, level. Treatment includes high-flow oxygen, non-rebreather mask. Hyperbaric oxygen therapy may be indicated for severe cases, COHB 25%, cardiac ischemia, neurologic symptoms, or loss of consciousness. CT is for head trauma, charcoal is not indicated for CO poisoning.